Start with that conversation. Let's do this. Hello, my name's James Pikeway, and this is Podaholiks. It's DocTalk with Dr. Jenna, which means we're going to be talking about who knows what. we have a plan. We have a plan, but you just never know where the plan is going to go. And, you know, we were already just talking about dogs, gyms, and Florence, your little dog. How old is Florence now, by the way?
So Florence can only be referred to as my baby, James, but she is 4.
Wow.
I'd never had a dog before Florence. And don't they say that a dog chooses you? Like I used to go to the same pet store all the time. So yes, Florence is shop bought. I'm ashamed of it, but it's not on purpose. She's the only ever dog or animal I've ever had that's not a rescue. And I was always in there buying things for my cats. And one day I just saw this dog and I just turned to my husband and I just said, James, we've got to get this dog. And he was like, what? We're not getting the dog. And I was like, there's something about this dog. And I couldn't stop thinking about it. I'd keep going back into the shop to check she hadn't been bought. I sent James cards asking him, please buy this dog. She's just, I know it in my heart. She's a member of our family. And we got her. In fact, James says that I went and got her without his permission, which, I mean, it was a bone of contention for quite a while. Now he's
4 years now. Does he still bring this up? It's been 4 years.
Yeah. Yes, James. And we are both obsessed with her, and she's just the best little dog in the world, and I adore her. However, just as a side note, don't agree in buying dogs. Don't really agree in overbreeding dogs, and she's very overbred. And she has health problems as a result, but she is my baby.
It's amazing just having pets around, isn't it? I know that we got a new rescue and we were talking about it just a minute ago. His name's Brando. And I think he's got some psychological things because he was a great dog that obviously had a great family because he's just so well trained in, for being at home. And then because of COVID or whatever, people lost their jobs. They had to leave him. And he was, I guess, it appears he was left very quickly. And so he transitioned to staying with some guards at a guard shack. And then the guard shack guys, after a couple of weeks, took him to the kennel for a rescue kennel. And he stayed there for a few weeks and then ended up with us. And, it's like, now the poor guy, every time you leave him alone, it's like, are you coming back? and all he wants to do is be glued up beside you. And he's 44 kgs. Of love. So, he's standing beside you and he gets what he wants.
The thing is at the moment you're in lockdown, so it's an artificial situation. So you're going to end up spending a fortune in doggy daycare. Believe me.
Well, he's good. We close the door to the kitchen and all that, but otherwise when we're not around, he just kind of lies by the door. And so I think he lived in a situation where the people who he obviously lived with did leave during the day, and they, he doesn't eat on the furniture. He waits to be given his toys. So once you give him a toy, that's his toy, and he's gonna, he's a lab, right? So depending on what the toy is, he's getting inside the toy. Some things don't last very long. He lets you know very quickly which toys are, heavy dog chew proof and which aren't. And so for instance, I was at Carrefour and I saw this great toy with a ball kind of thing on it. And I thought, what a wonderful toy. And I brought it home 7 minutes before he destroyed the ball on it. And then he brings it to me, he brings it to me tail wagging. Look what I did. And I went, yeah, that wasn't a good one.
I mean, this is totally off the topic of medicine. However, I will also add to that. I think what's sad is people don't really appreciate the commitment of having a dog. We also we basically took a stray in, and her name is Mona Fiona, and she's a lovely dog. However, when we went to visit her, she was really placid, sedentary, and we thought, great, she's going to be quite a quiet dog, great to have around children, great with our other dog. Now that she's settled in and she's got used to us, she is wild. I mean, absolutely wild, James. Even in the daycare centre, they used to say how quiet she is, and now she doesn't leave any of the dogs alone. She wants to play. And I think you've got to appreciate it's not just about getting to know the bad sides of the dogs and the good sides, but also just the level of commitment that's required. It's effectively like having a child for life, for their life anyway.
I think I've almost created. You got the boys? Are the boys coming in there behind?
No, do you know what it was? It was James just walked through in his towel, and I just wondered whether
we
you realised
it. We missed it. a little Chippendales in the morning. That would have really made this.
Anyway.
Our big Brando there, I've created a monster because we take him, he loves to go out for a walk and stuff. And so I take him for, a nice run in the morning, a good 4-5K run. And he's ready for that run every morning. So at 7:00 or, now it's getting warm. So at 6:00, you got to be out there doing that. But he's waiting. Like he's nudging you. Come on, let's go. 7 days a week. Come on, let's go. I'm ready to go.
Well, actually, that's a really good point. So if we do try and bring it a little bit back to medicine, I have to say I really do believe in animals as helping with loneliness. I've lived on my own in the past. I lived on my own quite a lot, actually. And what always helped was to have a couple of cats around the house. In fact, in university, they used to call me the crazy cat lady. And I always thought I was going to end up with 2 teeth and like a goggly eye because I always had cats. But it does, it helps, and it really makes a house feel like a home when you walk in, you've got animals walking around. And we were talking about it with Zainab, my friend who's a pediatrician, about how they just help with emotional well-being. And what's really odd, I don't know if I've ever told you the story, James, but we used to have them in a hospice that I worked in, because on the day that somebody was about to die, the cat would I think I have mentioned it to you because you're nodding, the cat would come and sit on that person's chest. And it was a really great indicator, and it had 100% accuracy. So much so, the other hospices in the area rolled in cats to see if it would work. And I don't know the outcome of how accurate it was for every cat. And we were able to then tell the family members that they needed to come in and, maybe spend a bit of time with them. It was a really great heads up. Something different is happening. I think that intuition, or this talk of it being a smell or whatever it is animals get it and we don't.
You didn't tell me that story, but I read a similar thing. I was reading.
No way.
Yeah, and it's identical to what you're talking about. So it's in the latest Stephen King book, whatever the second Shining is called. I can't remember. Whatever the latest one is called. So you remember The Shining, and that's where what the possessed kind of person see. Whatever. But on the second version, it's when the young boy has grown into an adult and he has the Shining, and he's able to help people when they're moving forward. But there's a cat that does exactly the same thing you're talking about. And the cat knows, and he sits with the people, and then it's sort of the indicator when the cat's leaving that he needs to be there because he's got to do his job. And it's kind of like, so I've heard that kind of thing. That's really interesting.
Well, there's a lot of things that animals know that we don't, and that's why we're all different species. But I always give the example of the fact that my dad, whenever he was coming home from school, he always tells me about how his dog would, as soon as the school bus apparently was coming from right down the road, he would the dog would get out the house and go and sit at the end of the path. And it's like, how would they know? How do they know? And even my dog, I know she knows as soon as we turn the corner to go to doggy daycare, she knows, and she gets excited. And I think I don't understand, but it's incredible, really. And we should make use of animals in this way for therapy, keeping people fit and healthy. You've just said you take your dog out. It's encouraging you even more so to go on your 5K run on the days you don't even fancy it. Now, James, you've got to go.
Well, and the worst part is the darn dog wants to run a little bit faster some mornings. So like today we were running at quite a clip, and it's good actually, because it's almost like some interval training, because he needs to stop to go to the washroom, and then I got to get out the bags and pick everything up, and so you get a little break, and then you start going, and then occasionally there's a cat, so he wants to investigate the cat. So that's I'm getting a little upper body workout as well. So, but I want to jump back to something else with animals that we've not at all in our notes, but I've been reading about using animals to help with sensing for some disease, kind of like they sniff for drugs. Dogs and things can also help sniff out some diseases that people have because of the way they interact with the body, and I guess the sense they create, or I don't know exactly how they do it, but in some cases, apparently there have been some good results. And I thought that's kind of interesting.
It really is. It's not something that I personally know about, and it's not something that I've ever come in contact with. But I think it's really interesting that it's almost like going back to, I want to say, like tribal medicine. It's kind of, sometimes we use chemicals and we're so quick to try and create things. And it's like there's an awful lot that nature has that we don't really utilize in medicine. And that would be a perfect example, the fact that animals can detect things. Why can cats detect death a bit earlier than we can? Something to do with, as I said before, like a smell or a hormone that is released, and they're in tune with it and we aren't. So why wouldn't we? It's absolutely fascinating.
Yeah. So the pets, the end story is have one, but be aware that it's going to take, they're there with you forever. And whether it's daycare, whether it's kennels when you go away, the maintenance, it's nonstop and you don't get a break, but hey, it becomes part of your family. And in our case, the two boys have moved on for, school and jobs and stuff. So this is just a new member of the family that never really gets beyond the age of, 10.
And also, just to round that off as well, is that they're really big for using animals in mental health too. Really like therapy pets. But as you said, if you're going to offer somebody a pet, just be prepared to have the enthusiasm and the wallets to pay for it. So expensive.
Well, just and the vet bills. I mean, not that I don't begrudge that and things, but they got to go to the doctor too, and an occasional checkup, and it adds. There's not pet health insurance, so at least not in our country. There isn't here, but I've heard of it in other places, but not here. So you got to make sure you got a great vet and be prepared for all of the little things. The dental work for dogs, even cats. With our cat that we had, he had to have teeth removed, and that's a big job. So yeah, no, I know it was terrible, but he had to do it.
But it is sad the way you say that people, they take on this commitment, they don't realize the extent of the commitment, then they leave them. And I find that really quite heartbreaking, because what I hadn't realized prior to having a dog is they're not that dissimilar to humans in many ways. They're very complex animals.
Yeah.
I'm sure there's an awful lot about animals that we don't know generally, but dogs are very deep. And as you said, you think your dog has some emotional scarring. And I'm sure that's true for a lot of them. So yeah, however, as you said, if you are looking at getting fit and healthy, a dog might be the answer.
Exactly. And that's where we wanted to go this week. Is we wanted to talk about, heart disease. And it's one of those things that there are so many other things making the news these days that we kind of ignore this silent killer that is constantly around us, and you're hanging out at home more. And for some folks, that means they're smoking a little bit more, they're drinking a little bit more, they're eating a little bit more. All of those things start to go together. They're not exercising as much. So you start mixing all those things together, and you prolong it, and it keeps going and it keeps building. And if you already had a pre-existing condition because you've already got you carrying a little bit of extra weight, the more weight you carry, the more your body has to work to circulate blood and oxygen. And your muscles can only work so hard. Try walking 10K, and then what do you feel? Your legs feel awful, and your thighs and your calves. Well, your heart's working all the time. And I think people just forget about it because, it just does its job, and it's not like a leg or an arm. And this was a great topic that you said, we need to talk about this again, because people really are not thinking about it.
It's not a trendy area of medicine at the moment. And I think back to working on the wards in the UK, and I would work in some wards where there were few patients, but it was a really interesting area. There was a lot of research going into it, and it'd be really well funded. We'd have lots of nursing staff. It'd be well equipped. There was no running around trying to find a cannula. Everything was there. Then you go on the general medical wards. Now, you ask any doctor or nurse in the UK about the general medical wards, and they are absolutely littered with people having heart attacks, general coronary disease, people that are at risk of strokes, diabetes. And it's not that it's underfunded, but it's not funded appropriately. And it's because it's not an exciting area of medicine. And so many people suffer from it as well. It doesn't attract the same level of external funding or charitable funding. I don't know the statistics, but from personal experience, it doesn't seem to be the case. And somebody mentioned to me recently and said, it's a shame that heart disease doesn't have the level of social media marketing that COVID has, because it's the biggest killer worldwide. It's the biggest killer. That's it, bottom line. And
I'm
yet
at a stat here,
don't
Jen.
realize
I'm gonna interrupt you just for a second, but I want you to keep going. But I just want to add a stat here, and this is an old number, and I sent this to I put this up on our list. So this is for 2016. We're 2020, but 40% of deaths in the UAE are from cardiovascular disease in 2016. And it sort of breaks it down, and it says, so communicable diseases are a whole other area. This is looking at non-communicable diseases, and it's saying 40% cardiovascular disease, 12% cancer, 5% chronic respiratory disease, 5% diabetes, 17% other injuries, and then there are 6% from nutritional things, etc. But 40%, just like you said, this is a huge killer.
And you have to remember that's in a population of that's a young expatriate population. Obviously, there are some locals that stay here till older age, but it's not representative of worldwide. I'm sure if we look at the American statistics, you'll see it's even more exaggerated. And in the UK, where you have an aging population, and people start to suffer from heart disease from any age, actually, but you tend to see it around the 50 mark. As soon as people start to hit 50, that's when you're thinking, okay, has this person got some level of heart disease?
I get that. I mean, and when you start looking at it, all of those sort of numbers go. So you get 50, you get the midlife crisis folks who go out and buy the nice sports car or whatever, and maybe they start hitting the gym and things. But when I head out to the gym or when I'm out running or doing whatever, I'm not seeing the 50 plus folks. And I'm okay, look, I'm stereotyping, I'm generalizing. But for the most part, I'm seeing the younger folks, the 30, 40 groups, the 20s, and the 50 plus, I don't know where they are because they're not out exercising, and their lifestyle is definitely calls for, you got to keep moving, you got to keep going, you got to keep doing these things, metabolism, all this stuff, and all these other things, diabetes, as you said, etc. And we'll go through the list of different things to think about. But it's like the switch gets turned off and common sense seems to leave.
Yeah. Do you know, it's funny because I once wrote a blog about the fact that now exercise has become, again, it's like a trendy thing to do, and girls wear their makeup, and some have got gym bracelets, and sometimes it's a little bit about like
the hair.
Gym. Yeah, and that's fine, that's great. But I often wonder, is that a bit intimidating for someone that's a bit older, somebody that's a bit larger, somebody that wants to get into exercise? And my husband often laughs at me because I really like what I'd say are inclusive gyms. So gyms that like open the doors to everybody. There's no judgment. People don't look you up and down. It's about going to work out and you leave. So he calls them muscle gyms. Like I like really basic gyms. I'm not a fan, not for any other reason than it's just where I feel comfortable, but I'm not as much a fan of these really slick, you know the gyms, the ones I'm talking about.
I know what you're talking about.
And I do wonder whether that's something that we all need to work on, is to try and encourage people to exercise more, not just say go and exercise, but maybe we need to give them a space to exercise where they feel comfortable.
The other side of it, when I think about the gyms and I think about people going to work out, and so again, if we're pegging the 50 plus crowd, it's almost like when you go to the gym, or if you're going to go and do a yoga workout or something, who are the people who are the trainers, who are the coaches, who are the people helping you out? So when I think of yoga, in fact, we do a nice yoga class, and we got this great yoga instructor. She's fantastic. And, yesterday I heard, it was her birthday. And I said to my wife, how old was she? And she goes, 30. And I went, wow, that's, she's old, but really young. and then I'm going, that's why she can do those stretches. That's why she's able to do all these things. And it's pretty rare that I find when I'm doing, say, my yoga stretching workout, we've got this wonderful lady that we've connected to with Zoom through the Zen studio. Her name's Penny. And I'm thinking she's got to be 50. Like I'm hoping that she is, because if I've now pegged her at being younger than that, I'm really sorry, but she just strikes me as being a little bit older, a little bit more mature.
I hope she is that age, James. Otherwise, you're in trouble.
I got to look it up now. You know what? I feel really bad because if she's not, but she just seems to be a little bit older, and I don't say that in look, but in just the way she talks about things. Like you just, a 30-year-old doesn't talk like that and have that kind of disposition on things. So I wonder if part of the challenge we have is getting the 50 plus coaches who have the same kind of knee pain as someone, who've got the same issues with their grown kids and grandkids, getting them into the gyms to help coach people, so that's the same people coaching the same people.
Yeah, so you need to hear my retirement plan, which I was
Okay, I want to hear it. I'm ready.
About, yeah.
I'm ready.
So I actually do have this as a retirement plan. But when I was in university, I went down and did a postgrad in London, and it was affiliated with a hospital because it was medically based, and they had this small hospital gym. And so I signed up. I was doing at the time I was really going for it with the weightlifting. So I was there with my barbell, and it was a great gym, only small, but inside it was full of patients. It was like a patient gym. So there would be such and such with her oxygen hooked on as she's on the bike. Another guy, he just had an operation and maybe he only had like one arm working out. And there was honestly a whole list of medical conditions you would find in the gym at any one time. You took a snapshot. And I just thought, how wonderful is this? Because everyone needs to work out, but these people really need to work out because they have a level of disease. They're on the path. It's not going to get better, but they can stop it getting worse. Yeah. So my dream, if I'm old enough to retire, I really wanted to be a personal trainer for people that have got disease or people that are bigger or older, trying to with some form of barrier, trying to get into exercise. Yeah. And you're right, it's a service that we need to explore more.
You know what? I say this over and over again, and I've said this on blogs. I've said this on presentations that I've done. It's online. It's recorded. It's there. You and I are very much alike. Different genders, different ages, different professions. But I was thinking exactly the same thing the other day, thinking, man, this would actually be kind of fun to get into, to keep working, but also to get into a training situation with folks who are in their 80s who just need to, using a chair, using the equipment that they have, whether it's a wheelchair or a walker or, reduced mobility or whatever, but just help them with some stretches that work for them. And I was thinking about this. One of the things that got me thinking about it was I've been wrestling with a little bit of hip pain for the longest time. And I was worried that there was something the matter until I, went and saw my osteo, and he said, it's just muscles. He said, and he's doing all those flexing rotation things because he's also concerned, right? And he's thinking, I hope it's not the joint. So he's got his fingers in places, and he said, no, it's not, your joint's fine. It was, but he said the muscles are so tight. So what I started to do, when you see, and this is, when you see some of the Indian and Pakistani guys who are sitting on the side of the road just resting, and they're kind of in that squat. I don't know what you call that squat, where they're kind of sitting down with, you know what I'm talking about?
Oh, I know what you mean, James. Yeah, I mean, that's a deep squat. It's a really deep squat.
And I was at Carrefour the other day, and there were some of the Filipino ladies, and you'll get, I'll think, I'm not stereotyping, you're not gender, poking here, but because I'm always so, you want to be, because we live where we are, there's always this political correctness. I always feel like I got to make sure that I'm not poking at a specific group, but there was a lady there also who was sitting in that really deep squat, and she was putting stuff on the shelves, and I was sort of walked by about 3 or 4 times because I kept forgetting stuff. And she was still sitting like that. The first thing that came to mind is you and I mean, I don't know about you, but I don't sit in that position very often. And I know my wife was telling me that she doesn't sit in that position. She actually finds it hard to get her feet down like that. But this lady was just sitting there, and the guys that I often see who are just resting or watching something on their phone, they're just sitting like that comfortably for like a long time, like maybe an hour. Or even a better one, yesterday I went down to Satwell, we got a pair of shoes fixed, and it'll all come together. You're going to get this in a second. The guy who's fixing the shoes, he's sitting cross-legged with both legs completely down. And I'm looking at this going, I can't even sit cross-legged, let alone like this guy's sitting there doing this. And it just all, as I was looking at what he did, and then as I was looking at these folks in the deep squats, and as I was thinking about my hip, and it goes all the way back to Bassam, when I start sitting like that, so in that deep squat and just staying in that position for 10 minutes, 15 minutes, all the pain goes away. And I kind of feel when I'm sitting there, I feel the muscles after about 3 minutes kind of go, and everything sort of lets go. And if I do that several times a day, I don't seem to have any pain at all. And that's when I was looking at all these people going, I don't think this particular group of folks, whether it's culturally inspired, the way they do these natural stretches, it just works. And so where this, to help with our fitness and our health, etc., leading into older age, all I kept thinking was, man, if you start doing these things when you're young, great. But what about the folks who are 50, 55, 60? If they can start to get some element of this movement, this position into their daily routine, it can help with those folks who've had hip replacements, who are going to have to go for hip replacements and things, to just keep the muscles a little bit more supple and help get rid of pain. So,
it's funny, James, because as you're saying that, all I can imagine is my poor knees. My knees could not keep me in that squat for too long. And we're talking about the wonders of exercise and how great it is. And you're talking about the wonders of stretching, and absolutely. But there's also that side of people that have exercised for so long that they've actually caused harm to their musculoskeletal structure. So my knees have been prematurely arthritic. Because I did so much running. I mean, I just went out in really bad trainers, thinking like end of the high school, university, I would just be on the pavements doing half marathons, like just not thinking anything of it. And I loved it. It was great, but I'm paying the price now for not having appropriate footwear and not really looking after myself. It's almost like if you want to exercise, that's great. But we've talked about it before. Just go and check in with your doctor. They might say, are you using some glucosamine tablets to try and keep your joints supple? Have you got correct footwear? It's you can't just go out and exercise without having somebody moderate you and somebody to check your technique. We've talked about the terrible injuries that can be sustained through weightlifting, and especially now there's the new, again, the trend, the exercise trend is to get the barbell over your head, and that's great. I love it. I love Olympic weightlifting. But that comes with its own problems. So you should really, to at least get started, seek a trainer, really. I mean, have you used it? You've used a trainer before, haven't you? You've been with in a fight in Dubai.
Yeah, I was with Marcus, and he was excellent, and and Carmen over there, she was great. Another person that I've used also is Jay Christie. He's here in Dubai. He's also a fantastic guy, just really, and it's wonderful having the trainer. I mean, you know this because you've used trainers, but it's little things. Even if you're just doing a push up, and they'll say, no, move your arms a little bit further back. Or if you're doing a squat, no, keep your back a little bit straighter. Or if you're lifting something, lifting was the big one. I was doing some lifts, and they're saying, no, hold on, we got to take some weight off. It's just, no, I can do it. No, we're going to take some weight off, and you're going to build up a little bit more. But it's just having that person watching the form and saying, no, get your elbows in. Makes a difference.
It's the ideal situation, but not everybody can afford it, and that shouldn't be a barrier to seeking exercise. There are 1,000,001 online tutorials. So occasionally I might get a weights program through and I think, I'm not quite sure how to do this, or it doesn't feel quite right. And I will then free on YouTube, Google, how do I do an RDL correctly? And then I'll watch it over and over and just go and correct myself. Like, there are ways to do it. And the sad thing is as we're talking about this, I hope that we're not deterring people from exercising because we're making it sound complicated. We're saying, go out there, do it safely, be careful, you might get arthritic knees, you might get some hip pain that requires extra stretching. And really, it's like, get out there and do it, but just start gently. I think it's when you get to the extremes that you need to have someone just give you a little helping hand.
And I want to talk about some of the things that you just brought up, but the helping hand and being realistic. So in my own case of my little achy knee that's getting my knees are actually not so bad. They're stiff though. And I've noticed this. So, I'm 54, and in the last year, I've noticed that my knees, they work well. They don't have any pain or anything, but they're stiffer. So, when you go down and you bend down on your, they're not as supple as they used to be. They're just stiffer. And I'm kind of going, oh, that's not good. I mean, I'm going, hold on, 54, knees are getting stiff. Let's say another 30 years. Oh man, this is not boding well for me at all. I think like you're saying, Jenna, my message would be, if you feel anything, the smallest niggle, and this is for me with my hip, I should have gone right away and seen my osteo or the physio guy as soon as I started feeling that tightness. Of course I didn't. I waited months. I thought, it'll go away. I'll run it out. I'll stretch it out. And yeah, none of that worked until I needed to go in and get the, 3 or 4 treatments where they're doing crazy, muscle release and stuff, and add some more stretches. If I'd gone right away, would have been okay.
But it's the same thing, isn't it, that we've talked about before in every aspect of healthcare. Prevention is better than cure. So if you go and take routine appointments, my advice would be, if you like seeing a physio, if you like seeing an osteopath, or even just to your general practitioner, just go and make an appointment. We started talking about heart disease, and it's the same for heart disease, for exercise. I really do believe, and Cheryl Walsama, the psychologist, she also mentioned it, I really believe in going to see your doctor to check in for a whole body scan. So is my heart, am I medically healthy? Am I physically healthy? And by physically, I mean musculoskeletally, and internally in my mind, am I healthy? And there's nothing wrong with going for preventative medical checks. There's just nothing wrong. Just check in. Like you said, you take your car every so many thousand miles, you take it to the garage to be checked over. Why don't we do it ourselves? We are a more complex version of a car. I mean, much more complex. Then hence, there's more things that can go wrong.
Yeah, exactly. Hey, I want to jump back to something you said, and then I want to come back to the heart disease stuff. Glucosamine tablets. Do you find they work? These are for joints and stuff.
I'm only going on patients' feedback, and I think the ones that take it consistently over a period of time, they do find that it just helps ease a little bit. And they also report that when they've stopped taking them, that they feel a bit stiffer. Whether that is the placebo effect, I'm not sure, but we do prescribe it in the UK for people that are suffering really quite badly with arthritis. It's something that we'll certainly recommend or prescribe. So from personal perspective, yes, I have had really good feedback from using glucosamine.
I've heard of folks saying who have done glucosamine stuff that it's a long lead up. So once they start taking it, it takes months before you start to feel or notice any effect from it. And I think that poses a real big challenge for a lot of us, because we want that instant. I want to take that pill, kind of like a Panadol. Take the pill, headache goes away. I want to take the pill, joints feel better. It's like, nah, it doesn't work that way.
No, because you've got to basically trying to build up lubrication in your joints. That's how they work. And yeah, that takes time.
So one more thing before we get back to heart disease, you've got your knee issues. What's your prognosis for yourself, over the next 20 years? What are you thinking?
Just don't think about it, James. I try not to think about it. I should get depressed. I used to love running, and that was always my sport, but I've moderated the sports that I do. So I do more kickboxing now. I told you I do weight training, which is really good. People don't think that would help issues that you have in your joints, but it does, because it takes the pressure off the joint. The muscle does the work rather than the joint doing it. So I'm very careful in how I exercise. I don't push it too far. I mean, if I'm doing cardio, I go for it. But when I'm doing weights, I'm very careful, like you said. I respect the fact that they can cause injury, and I've just had to moderate it. Occasionally, I'll try and go out for a little run, and it reminds me, every time I go for a run, it reminds me how much I loved it. It was a real mental health thing for me. You put your headphones on, you go, especially in adverse weather conditions, whether it was really sunny, whether it was really dark, whether it was raining. Running in the rain was wonderful. If it was a bit of snow coming on the ground, and even better, the best thing is hail. Oh, that was just wonderful to run in.
Hail.
Yeah. Oh, it's fantastic. And if you went on holiday, you took your trainers, and you'd find all the best spots to go on holiday. It was really, always has been my favorite form of exercise, and it's sadly the one that I probably do the least now. And that's why I think you just have to, respect the fact that your body's changing, and you've just got to go with the times. But every time I go above about 40 minutes running, I really feel it. So I just don't.
Yeah, you know what? That's about, I stick to about a 40-minute routine myself. So, that's about a 5K for me, and at a decent pace. And after about 40 minutes, and it's funny because I was planning to do another marathon. And I said, after I did my first marathon, I said, yeah, I'm not going to do another one. And then it's like a drug, right? And after about 2 months, I said, I can do better. I can do it faster. And started to ramp up the training cycle again. And as soon as I got over about an hour and 20 minutes running, calves started feeling odd and things. And I was running one day and all of these little things started to come up, and I wasn't even doing mega distance. I was only doing about 20 Ks. And I realized, yeah, this is not going to work. It's not worth it. It's really, really not going to be worth it.
And sorry, go on, James.
No, keep going.
Oh, I was just going to say, and you don't need to do that to yourself either. We are normal people that like to exercise, and I think sometimes it's wonderful, and we've talked about this before, it's wonderful that we have these amazing athletes out there encouraging people to exercise. But I think what you and I say is, look, everyone can exercise, everyone should. Just incorporate it into your daily life. And the American Heart Association did come out a number of years ago and say, to keep your heart healthy, you need to get your heart up to the maximal heart rate for 10 minutes a day. That's all, 10 minutes. So yeah, HIIT workouts are perfect for that sort of thing. Really get your heart rate right up. If you're going to do steady pace, then yeah, you need a bit longer. But to really get your heart rate right up and just keep it up as much as you can for 10 minutes, that's absolutely ideal. And nobody's got any excuse for that. And I think the lockdown has been the perfect time for us to remember that and to realize, actually, we don't need to go to the gym. We don't need, we don't need all this fancy equipment. We can keep our heart and our bodies healthy by just little snippets here and there.
I want to jump right back into this because you've opened the door with the American Heart Association. But when we start talking heart disease, and this is kind of a crazy thing because we use the word heart disease a lot and we hear it all the time. I'm pretty convinced people generally have no idea what heart disease actually is. And because of that, that's why we don't see more mitigation being done. We don't see people doing more things because the term is just, well, we've heard it over and over again. Heart attack, heart disease, we lump them all together. Diabetes, heart disease, we lump it together. And we kind of sit there going, I don't know what to do. It's going to hit me. It's going to hit me eventually. I'm just going to leave it all to chance, which is, I mean, as you've experienced it with folks who have started developing some of these, some signs and symptoms. When we were talking with Cheryl and she was talking about panic attacks, mimicking some of the heart disease things when people have those. And I thought, we just have no idea. So can you jump in and sort of give us the thumbnail sketch of what heart disease is?
Yeah, I'll try and keep it simple because normally when I do teach people about this, I have slides and I have pictograms to kind of explain it, which makes it a lot easier. But effectively, heart disease is basically the same thing as a stroke, but it's the heart, not the brain. So what the problem is,
stroke is brain. Stroke is with your head.
Stroke is brain. Heart disease is obviously heart. Yeah. But I'll explain both of them. But all your blood vessels running around your body build up a plaque inside, and that is caused from smoking, obesity, diabetes that's uncontrolled, and high blood pressure all builds up this big plaque. And what happens is eventually that plaque gets so big that it actually blocks off one of the smaller blood vessels in the heart.
I got a question.
Go on, yeah.
So I'm putting you on pause. Plaque, that's where we're at. When you were doing your medical training, did you have to do some work with cadavers?
Yes, yeah.
When you were working with the cadavers and when you were looking at the heart and blood vessels, did you see this plaque inside things?
It'd be too small, like be tiny. Okay. I mean, it wouldn't be too small, but it'd be very small. And in fact, okay. Tallulah, the lady that we had, my first lady, before Reginald, I named them obviously. She died of a heart attack at 88.
Wow. So you didn't see the plaque. Okay, back to your plaque. I was just curious if it's like a big white, kind of like you think well, it's kind of like teeth, right? You don't see the plaque on your teeth. You feel it, you taste it, but you don't see it. Okay.
Usually like a yellow. It's fat. It's like a fatty substance. Gross. But when it blocks one of the vessels, so the oxygen which is in your blood can't get to a part of the heart. So all your blood obviously carries all the oxygen, but if you're stopping it in one of the small vessels of the heart, part of the heart can't get oxygen, it can't get nutrients, and if it's left long enough, it dies. And that is the process of a heart attack. Angina is when the narrowing is it's becoming smaller, so the amount of blood that gets through isn't very much. And then sometimes if you're running or you're walking upstairs, the heart needs more blood, so it needs more oxygen, and therefore, because this narrowing is so tiny, it's not getting as much as it needs, and it starts to hurt. So that's angina. So it's not a complete blockage, it's just it's smaller, and it's getting to the point that it's going to be a problem. It's going to start causing a heart attack. So people that don't get treatment for heart attacks actually can get death of part of the heart, which is why you need to act quickly and get to hospital. And the same process is for a stroke. There are two types of stroke, but for what we call an ischemic stroke, and ischemia just means not enough oxygen, that it's the same process. One of the blood vessels is blocked in the brain, and if you don't act quick enough, you can get death of part of the brain.
So when you talked about uncontrolled diabetes, you've talked about this plaque buildup. What I mean, how do we is this inevitably going to happen to everyone at some point, that all of the
disease generally is inevitable eventually? So it's kind of like saying we don't really count a first degree relative having cancer, for instance, over the age of 80 as a huge risk factor for their child, for instance, because, well, they're over 80 and these things just start to happen eventually. So heart disease is a process that is kind of occurring because it happens, we get older, and everything starts to show signs of weakness as we get older. The real big thing is we need to delay it as much as possible. So it's nothing radical, and it's why we always talk about it, but it's having a good diet and exercising and not smoking and keeping alcohol in moderation. That is literally the winning formula. The only added to that is stress. Stress does have an impact on the heart. There's been more studies out to suggest that long-term stress has an impact on the heart, puts you more at risk of what we call cardiac arrest, the heart stopping. But that is a different process. So basically stress and the heart, they don't go together very well.
So what can I do as Joe Public, who's, in their 50s? What should I be doing to determine how far along this path of inevitability I might be? What do you suggest?
So the main thing is to go to the doctors and have a chat with them, and they review what medications you're on, look at your blood sugar, look at your heart, look at your blood pressure, look at your family history, because there is a genetic predisposition. I always say to people, like, look, you're looking at about a percentage, I always say about 50%, but it's probably less, is genetic. So some people will get raised cholesterol in their 30s, even though that's unusual, and they might be fit and healthy otherwise, but that would be a genetic thing. So you've got this genetic predisposition, and then you've got lifestyle modifications. So it'll be weighing up the two, and there are charts and formulas that we use to work out your 10-year risk of a heart attack. I've done it for myself. Just Google it online. 10-year.
What did you find? What did it say for you?
I can't remember. I think it was less than 1%. I hope. Something else. Get me, James. But yeah, I think it's less than 1%. But that, age is taken into consideration as well.
Right.
So ideally, to really assess properly, you would look at somebody's blood pressure, their cholesterol levels, and have the conversation with the doctor so they can put in other risk factors. Also, if you've had a heart attack or you've had a stroke, that puts you at increased risk because your body's already started with the morphology to be further along the line. So what we used to do in the UK, for instance, is when somebody came in and they had a heart attack, we would then give them all this medication to go home with to try and prevent it happening, and that is reactive medicine. But what we want to do now is try and get to primary prevention, which is to find out the symptoms that they're having that could be warning signs, and then start treating from that point.
Okay, what are some of these warning signs? Because there's a lot of folks, and I mean, you had a situation where you were talking with someone who had a lot of these warning signs coming up. They must have had warning signs earlier. What are some of the warning signs I need to be thinking about, or our listeners, our viewers need to be thinking about as they're trying to assess themselves and potential heart disease issues?
So the main one is angina. So if you're somebody that develops pain on exercise around the chest area. And a lot of people get that confused with the fact it has to be left-sided. Oh, I don't have left-sided pain. It's actually central. Well, central chest pain is the earmarked pain for heart attacks. So if you have a central chest pain that comes on when you're going up the stairs or when you're exercising, that is a big red flag. That suggests that you have got angina. And usually people will tell a story of it being progressive. So occasionally when I was walking, I would get a central discomfort. And then they'll say, actually, I've started to get it now when I'm just going up the stairs, or I've started to get it at rest. And that's when it becomes more and more unstable. The second big one is breathlessness. So if people start to get out of breath. So if you find that you're walking on an incline or upstairs and you're starting to get sort of tugging a little bit more than you would normally, or for your fitness level, then again, those are the big two really. Other than that, it's just about sort of reviewing if you're somebody that is having headaches, suggests that you might have high blood pressure, or somebody that is getting a little bit woozy before their meals, could be a sign that they are becoming insulin resistant, potentially diabetes. But breathlessness and chest pain would be the two big markers. Obesity, how does that factor into all this? Obesity, smoking are the two big players, James. I mean, it's there's no way around it. You see a population that is obese, you're going to see a lot more heart disease. And it's a really difficult one because we're kind of got this seesaw, haven't we? Or we've got to be careful. We've talked so much about being really careful that we don't upset people about their weight and people that have got weight issues. And there's definitely a huge population with that. But at the same time, we're also looking at population with rising obesity levels, teenage obesity, childhood obesity. And how do we tell a young 12-year-old girl that actually we need to start changing your lifestyle because you're suffering with obesity and you're going to die prematurely if we don't change this, but yet not send her off on a spiral to an eating disorder, which can happen. And as a healthcare professional, that's really difficult because, especially talking to parents, really difficult. And in fact, even talking to adults, it's an uncomfortable issue. Some people are very, very sensitive about it, especially because an awful lot of obesity is driven through emotional eating. So it's a really, really difficult one and has to be dealt with exceptionally sensitively. And I don't think the medical population do that very well. I think society in general doesn't do it so well. It's actually a funny one, and I'll share this one with you because we were fortunately on the beach on the weekend, and so a lot of folks like myself were in our Speedos and things, and the number of young guys that I noticed who you know, kind of, they weren't obese, but they definitely had that spare tire starting to form. And I say they were young just because of the people they were hanging around with. So, you know, mid-20s, maybe 30 if they were lucky. And there was this one guy, and it was a really interesting situation because all I can imagine, so everyone was social distance, so people are kind of spread apart, but the conversation got very animated in a good way because this guy was there, and he was clearly some guy who had been bigger because of the way everyone was reacting to him when he took off his shirt. And he was, I mean, I'm looking at this guy going, man, that guy looks awesome. You know, I mean, it caught my attention, and it wasn't that, you know, he was ripped or anything, but it was just, it was great proportion. And there was a comment that got made. And again, I didn't, you could only get it from the actions, but there was a guy beside him who was more like me, but you know, a little bit of girth on his stomach there. And this guy said something, and the guy who clearly lost the weight said something back. And, you know, what the reaction was, yeah, you know, you can do this too. And this is how you do it. And you can look like this. And it didn't go over well, especially when everyone else was pointing at the guy who had lost the weight and the guy who could use losing a little weight. I know it was like, but then they sort of worked it out. And he's, you know, you could see the guy who, and I think it was the reality that the guy who knew that he needed to lose a little bit of weight knew it
And he just, I think it was the motivation. What's the motivation? And it looked like the guy who lost it said, you know what, we're going to work together. I'm going to help you. That's because they ended up putting their arms around each other, and as you know, there was some head nodding. So I figure that's the way the conversation went. And at least in my mind, I'm imagining it did, but it was interesting.
But the opening line that he gave to the gentleman that needed to lose the weight was a little bit of almost like fat shaming. And I don't know whether you've heard this movement that there is in the medical world at the moment, but there's a lot of people that need to see the doctor for various different reasons. So if you're obese, you're more likely to be diabetic, type 2 diabetes. And I mentioned the statistic to you that if you are a type 2 diabetic whose diabetes is so badly controlled that you then need insulin, your 10-year survival rate is exceptionally low. So,
really?
I want to say less than 10%. I can't remember the statistic, but it's you kind of know on that risk factor we were looking at, and that's from death of cardiac disease, not from diabetes. That's cardiac disease, because diabetes, cardiac disease go hand in hand. And so these people need to seek medical attention. Everyone should be going every year to see their doctor. We've talked about that, especially in Dubai. We have the luxury of a private healthcare system, and we can go and see and check in. Over the age of 50, it's absolutely necessary that you should go attend what we call back at home the well man, well woman clinic, which is again once a year, just going in, having some routine blood tests, speaking with your doctor, finding out if you've got any of these factors. But these people need it more than anybody, and they're not seeking medical attention. They're not going to the doctor because they're so embarrassed and so worried that they're fat shamed and told, look, why you need to lose weight. And you've heard it here, especially, there's cultural differences in the way that we speak in Dubai and everywhere, but more pronounced here. And it's really sad that these people feel that they are mocked or ridiculed or just shamed, especially when they're in an environment that is supposed to be encouraging and supportive.
And it's a tough one. It's like you said, it's that fine line. How do you balance it out? And when you have so many things available to you, when I talk, the restaurants and the takeout and what did I say the other day? 3 jalapeno chicken burgers from one of our burger joints delivered to your door for 18 dirhams. I mean, that's. Can you hear me now? That's crazy.
I can hear you saying you've gone. It sounds like the aliens are back again.
This happened the other day. Let's hope that it sorts itself out. Otherwise, we'll call it a day. But this happened the other day as well. We're doing this very kind of recording at about this time. Into it, I started sounding like Darth Vader on the other side of the. Is that still happening, Jenna?
It sounds like E.T. is here, and E.T. wants to go home. Yeah.
That's really weird because on my side, you sound awesome, and I sound like E.T. now, the Darth Vader alien creature.
So you can't hear it at all?
No, I hear you perfectly, and it sounds perfect on my side. Very odd. So maybe we need to think about wrapping up our podcast. So what is your message? What is your message to folks as we start thinking about heart disease? What is your parting words on this scenario for folks? What do they need to be doing? What do they need to be thinking?
We've talked about a few things today, and I hope that, as I said before, I hope we've not confused people, because what we're saying is, look, everyone, you've got to exercise. You've got to exercise. It doesn't matter how little, how much, to what extent, just start doing something. You've got to, and I think what is wonderful about working from home is I do think that the COVID situation has taught us that we are capable of doing it ourselves too, and we don't need to have fandangled equipment, etc. However, exercising, eating healthy is the winning formula, not smoking, not too much alcohol. But when you do start exercising, don't forget that it might be worth having a chat with somebody that's experienced in exercising, just to give you a bit of a helping hand to do things properly and to not incur injury. And anyone, so especially over the age of 50, but anyone out there should be going to see their doctor. Not anyone, but everyone should be going to see their doctor once a year, just to check in and have the conversation. Assess your risk factors, assess if there's anything that you can be doing to help your situation and to reduce your risk. And I'll tell you that apart from medication, which is obviously further down the line for people that really need it, number one is always going to be lifestyle and exercise. And there was a quote, I can't remember who it was from. It wasn't anyone significant anyway, but I read it and I really liked it. And it was just saying how any tablet that you give somebody is never, ever going to be as good or have the same effects mentally and physically as exercising and eating well, because that is the medicine, really.
There we go. I got to say that this has got to be one of the best doc talks we've done. We've almost completely stayed on topic.
James, how can you say that? We didn't stay on topic at all. We spent the first 50 minutes talking about dogs, for which I've got absolutely no qualifications whatsoever.
It's all linked together with healthy lifestyle and keeping our minds in tune. This is awesome.
I was honestly like, sometimes when we're doing doc talk, I think these poor people have tuned in to hear about medicine, and then they've kind of got the whole can of worms.
I think that's exactly why they tune in, because they like the whole can of worms. They like what you got club soda there? Or are you drinking Red Bull?
No. It's a club soda. I've given that up, James.
Oh, look at this. Look at that. Look at that puppy. Look at that.
Well, this is water with lemon and cucumber.
I've got eggplant. I've got Brussels sprouts. I've got zucchini, tomato, cucumber, and carrot in there. Look at that. Isn't that beautiful?
I mean, I think it's great that you drink them, but I do feel sorry for your wife.
Brussels sprouts, that's what makes this one really powerful.
Exactly. Yes. I mean, she is one tolerant lady. That's all I can say. We have talked about good lifestyle in moderation.
In moderation.
Drinking liquefied Brussels sprouts in the morning that's really going for gold, James.
Oh man, Jenna, this has been a lot of fun as always. I look forward to doing it again really soon, and we're as we try and fit things into my new teaching schedule for summer, which I'm feeling sorry for my students, but it's gonna be a fun. I got a 5-week stint teaching my students how to be awesome presenters. And we're doing what they all think it's going to be awesome. This is going to be a great course, easy to get a great mark, until they look at the time schedule. And I always say this to them. I say, public speaking is not a hard thing to do. In fact, it's really easy. It just takes practice, and it takes putting into effect a lot of things that, it's just like doing exercise. It's just like doing everything. As soon as you start changing your routine, it feels uncomfortable until you get used to the new routine. And so my students only have 5 weeks to change the routine that they've been doing for 15 years of their lives, talking and how they present and things. And it's brutal, because I was looking at the schedule of things, and it's every Thursday they have to do a speech for 4 weeks. And I'm thinking, a 4-minute speech on the way that I want them to do it, that's a lot of work.
James, don't shout at me, but I think you're probably a great teacher, but I don't think I could cope with you being my professor, because you've got standards, like serious standards. I could never be top of the class or teacher's pet. It'd be hard to be a star for James Piper.
You know what? You would be okay. You would give in, and you would start following my plan. I got to tell you, I got this great story. You're going to love this story. So I had this student who was in my last cohort of public speaking, and essentially the course is public speaking and professional presentations. And I lead by example, and I say to them, look, from the moment we start, everything I'm doing is what I expect you to do. And I said, so if you just want to get a good mark, just copy me. And I said, don't be me, but you use the same techniques, whether it's gestures, whether it's voice, whether it's organization, all of these things. From the moment we start, I'm doing the things I want you to do. And I said, look, I already do podcasts. We do 4 or 5 a week, 6 a week. That's 6 hours of practicing professional presentation. So I practice the same thing over and over. But so the student comes up to me at the end of the class, and she's really quiet, Jenna. It was, one of those really soft voiced girls. And she looks at me and she's in tears. She says, sir, I got to drop your class. And I said,
oh,
really?
No.
I said, what? And she goes, sir, I can't do it. I said, what you want me to do? And this was sort of week 2 of so in the regular semester, it'd be a 15-week course. This is week 2 of 15 weeks of stuff. And I'm looking at her, I'm going, really? I said, what can't you do? And she goes, well, I like yourself. She said, I don't know if I can meet the standard. I don't know if I can actually do this. And I said, I said, I'm not seeing what you're seeing, because I think you've got all of after 2 weeks, you get a sense of who's putting in time and who's listening and who's trying and just getting rid of the ums and the yannies. If I can get rid of that in the first week, I've succeeded. And she's looking at me. She says, I just don't think I can do it. This girl ended up finishing the class, and she did her final speech. And yes, it's professional, public speaking, professional presentation. Essentially, it's talk like a TEDster. That's what I'm teaching them to do any kind of presentation, which is sort of the underscore of all of my class, is why isn't every presentation like a TED talk? And they kind of look at me and go, what do you mean? I said, there's great science talks on TED. If you want to, actually, my favorite medical talk. Do you ever watch TED Med, Jenna?
No, I didn't even know there was a TED Med.
Yes, TED Med is spectacular. You've got to watch the David Blaine TED Med talk, because it is frightening as well as spectacular at the same time. David Blaine, the illusionist.
Yeah, I know. He terrifies me, James. I know who he is.
You need to watch his talk, because it's terrifying. He basically talks about how he does his illusions. And he's terrifying, this guy. Like, he is absolutely a terrifying dude. But it's great with TED Med. Great stuff to watch. Anyway, she wanted to drop out, and I said, I wouldn't. I'd stick with it. And she ended up finishing the class. She does her final speech, which is TED-worthy speech. And she ends up talking about about the whole class and how she was going to drop out and what she learned and what she did. And she was literally a 98, 99 percentile student. She was like,
wow.
I think she almost did a perfect score in the class, because she just followed everything. And the turning point for most of my students is when they take. So I also talk to them about how to do presentations for classes. And because every teacher says, okay, you got to do a group presentation. And I'll say to them, I said, but they don't tell you how to do the presentation. They just say you have to do a presentation. And I said, if they tell you exactly what they want you to do, well, you obviously follow that along, but they never tell you what to do. They just say do a presentation, which means you can do the presentation any way you want, as long as you have certain information. So I tell them, this is what I want to see as a professor. I don't care how you get it there, but this is what I want to see. And there's no rule that you can't have a little bit of show and stage theatrics and X, Y, Z involved. And so every semester I get a group of students who say, James, you're full of crap. And they say, I don't believe you. Because they're saying there's no way. There's just, why would no one have ever told us this? And I'm going, because why would we tell you this? It's like, they just do it. And so I always tell them, take everything I've taught you and now apply it to another class. And they're going, no, it can't work. And I said, no, I'll even throw in the bonus. I'll coach you on your presentation for the other class for the rest of your life. Anytime you need some coaching, get in touch with me. I'll coach you on a presentation, because I think that's really the way that people learn to present better. It's not just going and taking a class. It's when you actually apply it to something. And so I always get a couple of students who say, James, you're full of crap. I'm going to apply to a class. And if I get a bad grade, it's on you. And every single student who follows the directions, follows what I say and does it, always comes out. I had one student come up to me and said, sir, I got the highest mark in the class. In fact, the professor singled me out as being the best presentation of the semester, following your advice, doing it your way. And everyone else was kind of looking at me going, why is she doing it like this? Why is she doing it like this? And the professor loved it. So,
do you know what I feel like I'm watching, James? You know those adverts?
An advertorial.
And hang on, you get it, and you keep scrolling, but it never gives you what you're looking for until you pay $49.99. And then you get the winning formula for James Pipeway's presentation. I'm already sold. I'm ready to give you my money.
I'll give you the winning formula. Here it is. Here's how you do an excellent presentation. Here it is. Introduction and conclusion. You need to have a clear intro and a clear conclusion. You need to have 3 clear points with examples in your speech. So that's the formula for every talk you're ever going to do in your life. So you need to, it's got to be organized, and you don't have to organize it as you're putting it together. You don't have to organize it in that order. You can do any of the orders. It doesn't matter. So that's the first thing. You need to have a clear pattern to the way you do it, and do them all the same way, because then you get used to it. And the more you get used to your pattern, the easier it is for you to do a talk on anything, because you just follow the pattern that you're used to. Second big thing, 90% of what you're doing is show. 10% is content. 90% of a talk is how you're saying it, taking the pause, how you're looking at things, are you using your hands. 90% of it is the show, 10% content, and practice the life out of it. Practice it until it sounds, because I'll do presentations and I'm like anyone else. I get really nervous. For me, the problem isn't talking. The problem is getting to the talk. So if I have to get up on a stage, I have no problem being on a stage. I love being on a stage. I love a microphone. I love the show. I have trouble getting on to the stage. So I get really, really nervous beforehand. People go, but you're good at this. You know it. I even get nervous before I go to my classes. So I have a whole routine that I do, because I get just really, really, really nervous about, starting. Once I'm started, A-okay. Starting, big problem.
That's exactly the same as myself, because I love presenting.
We're more alike. We keep thinking.
I know. Exactly. But yeah, same. So as soon as the first few lines are in, that's it. I feel like I'm free. I'm on stage. It's absolutely wonderful. Yeah. It doesn't matter what setting that's in. Like you say, even if it's in a small classroom situation, it's a show. And even in medicine, sometimes I remember a doctor once telling me it's showmanship. A lot of this is showmanship, and you will trust a doctor more, not necessarily on how well they've trained or their knowledge, which is sad sometimes, because sometimes the really great doctors don't get recognized as being such because they're not presenters. But even when you've got your patients, sometimes it's a bit of a show, and I love it. So maybe I need to sign up for the class. Next year, James.
Yeah, next year. On that note, Jenna, you know what? It has been absolutely spectacular. This has been DocTalk with Dr. Jenna Burton. We talked about
everything.
Everything. And more. You want to get in touch with us, Podaholiks with a K at gmail.com. We're across the socials, Podaholiks with a K, www.podaholiks.com. And of course, if you're listening to us, however that is, do leave us a comment, do leave us a rating, and we'd love to hear from you. We'll do it all again real soon. You're listening to Podaholiks. This has been DocTalk with Dr. Jenna Burton.